For over 25 years, I've stood at the operating table performing life-saving heart surgery. And in that time, I've seen something that's always troubled me. Patients who did everything right. They run marathons, they eat healthily, they never smoked, and their cholesterol was completely normal. And yet they found themselves needing complex bypass surgery, or they've had a heart attack, or sadly, some of them may actually have died from a heart condition they never knew they had. And the question has always lingered with me, why is this? I'm Inder Birdi, I'm a cardiac surgeon and founder here at the Keyhole Heart Clinic. Today, I want to share a groundbreaking discovery that finally answers that question, and it could fundamentally change how all of us think about heart health. There's a landmark study in the New England Journal of Medicine called The Inherited Basis of Coronary Artery Disease, and it has actually provided us with the most comprehensive answer to date. This isn't just academic research anymore. It's actually a vital roadmap for every single one of us concerned about our heart health. It confirms what we at the Keyhole Heart Clinic have always long understood. You see, our genetics act as the silent architect of our arteries, whilst lifestyle choices influence how much debris we put into the system. Our DNA determines how our body processes that debris, how our arterial walls respond, and ultimately, how likely we are to develop blockages. The study makes a crucial distinction between two types of genetic risk: monogenic risk and polygenic risk. Think of monogenic risk as a single powerful light switch. If this switch is flipped, it has a massive impact. The most common example is familial hypercholesterolemia, or FH. This is a mutation in a single gene that affects about 1 in 250 people, causing dangerously high levels of cholesterol from birth and often leading to early heart disease and death. But here's the real breakthrough: polygenic risk. For most of us, it's not one broken gene, but instead it's hundreds or even thousands of tiny variations in our DNA. Individually, these are like turning a volume knob, just a fraction of a percent. But when you add them all up, they create what's called Polygenic Risk Score, or PRS. This cumulative volume of genetic risk is what truly determines heart disease risk for the majority of the population. Perhaps the most startling revelation from this study, though, is the power of polygenic risk score in identifying people who are currently invisible from traditional medicine. The research team found that individuals in the top 5% of the polygenic risk score had 3 to 5 times higher risk of developing coronary artery disease compared to the average person. To put that into perspective, having a high polygenic risk is equivalent to having a major clinical factor like smoking or diabetes, yet it often goes completely undetected because it doesn't always show up in standard blood tests. This, I think, is the missing link that I've seen in my clinic. These are the patients who arrive with advanced blockages despite having healthy lifestyles. Their traditional risk scores might label them as low risk, giving them a false sense of security, while actually their genetics are silently driving progression of disease in a cumulative way. So what should you do next? If you have a family history of heart disease, or if you simply want to take full control of your health, the findings of the New England Journal of Medicine article should be a call to action. And here is a comprehensive heart roadmap for you to consider. 1, the family tree audit. Talk to your relatives, look for patterns of early heart disease, strokes, or sudden deaths. 2, advanced blood markers. Ask your doctor for more than just a standard lipid panel. Specifically request lipoprotein A. This marker is a critical indicator of genetic risk of cardiovascular disease. 3, coronary artery calcium scoring. This simple, non-invasive CT scan shows us if calcium buildup and plaque has already started to occur in your heart arteries. 4, polygenic risk assessment. While still emerging, specialized clinics can help to interpret your genetics and give you an idea of your overall cardiovascular risk. 5, a consultation. If your tests show you are at high risk, or if disease is present, consult a specialist who can understand how to manipulate that risk and reduce your risk of heart disease. The New England Journal of Medicine article marks a turning point, in my view, in cardiology and cardiac surgery. It moves us away from the mystery of why me and towards the clarity of this is my blueprint and here is my plan. Your DNA is a powerful influence, but it's not your destiny. If you embrace the science of genetics and combine it with proactive expert care and preventative medicine, we as doctors can ensure that your heart remains healthy for decades to come.